Complex social issue that I'll be discussing in today's assessment for assessment number 4 is the price of prescription drugs in the United States versus the rest of the world. According to drugwatch.com, the United States pays on average, the consumer in the United States pays on average of 56% more than other advanced countries in the world. And that's not considering third world countries. That's France, Germany, Italy, Spain, UK, Canada, Australia, and so on, Sweden. Right now, there's a savings rate of 67% in France, 51% less cost in Germany, 57% less cost in the United Kingdom, 65% less cost in Canada. So right now, the average American per year spends $1,112 per person per year on prescription medication. For those same medications in Canada, the average Canadian only spent $772. So according to a poll performed by NPR, a lot of the U.S. population, at least that is close to the Canadian border, is actually getting the prescription medications from Canada. Right now, the figure is 19 million, which is approximately 8% of the U.S. population, says that they went to Canada to obtain high-cost prescription drugs that they can't afford in the United States. I'm going to pause. Nexium, for example, is one of those drugs, according to drugwatch.com, that AstraZeneca manufactures and sells in various countries throughout the world. One 40 milligram pill in the United States costs $7.78 compared to $3.37 in Canada. And the price drops even more in other countries. You can get this pill made in the same plant, manufactured at the same time under the same standards in India for less than 37 cents per pill. The crisis that we're reaching here is that many families cannot afford these drug prices. Some of them have to choose between getting their medication to stay alive and feeding their children, or paying their bills, or going without. When it really is something that, as an advanced country, we should not allow to happen. So the other side of this argument is from the pharmaceutical companies. According to Vox.com, basically did an interview with different drug manufacturers. And this is some of the things that they had come up with. According to the 2017 Janssen U.S. Transparency Report, which states, this is from the drug manufacturers, that we have an obligation to ensure that the sale of our medications provide us with the resources necessary to invest in future research and development. In other words, their prices are to fund expensive future research. This explanation is common among industry executives. To many Americans, it seems plausible, but I don't see that it's the ethical decision to make, is to put the bulk of the funding on the American people to fund new research. I believe it should be shared throughout all the countries, and the prices should be maintained to be something that the viable citizen from any country can afford their medication. One of the reasons for this is that our government allows this to happen. In other countries, some with federally funded medical care, those other countries will actually go and negotiate prices with drug manufacturers. In the United States, there's little government regulation. For example, Canada's Patent Medicines Prices Review Board, the PMPRB, according to GoodRx.com, requires that new medication cannot cost more than the median price for the drug in other countries. Other countries in the European Union use similar pricing constraints. The U.S. does not impose these rules. They basically give the drug companies the freedom to sell these medications at any price that they seem fit. In a lot of cases, some of these medications are going over in the hundreds of thousands of dollars per year, and some are even getting close to the $1 million per year mark. But one of the biggest problems is that prices are rising faster than inflation. According to an AARP report in 2015, prices for a sample of 268 widely used drug prescriptions increased by 15.5% compared to a less than 1% inflation rate. Especially for, there's also lack of competition with generic drugs as well. Dramatic increases can really come into play. It really is impacting the United States consumer the hardest. My opinion on this is that the American consumer is being currently taken advantage of, and it is really not an ethical decision to make by these pharmaceutical companies to overcharge the American consumer, really to offset their investment costs in research of new medications, and allowing, really the rest of the world, they're charging them a fair price for the medication. I really think that our government should get involved and negotiate better pricing with pharmaceutical companies, but it really should start with them as well. They should look at their own companies and look at sometimes the harm or deaths that are occurring because patients can't afford their medication. It's really wrong. And it's something that should be done about that. I don't think that we should be paying $8 for medication that costs 40 cents in India, and vice versa.